Ehlers-Danlos Syndrome, or EDS, is a connective tissue disorder. This means that it affects many different parts of the body. EDS is the name given to a whole series of inherited conditions that are defined as hereditary disorders of connective tissue. There are 7 types of EDS, and the most common type of EDS is hypermobility type. When doctors are training, they are taught to think, when you hear the sound of hooves, think horses, not zebras. In other words, they are told to assume the simplest diagnosis to try and avoid diagnosing more serious conditions, so patients are not diagnosed with conditions they do not have. However, this leads to conditions like EDS being looked over and leads to EDS sufferers being known as medical zebras. There are many symptoms of EDS hypermobility type, but the most common are chronic widespread joint pain and joint hypermobility. Other symptoms include flat feet, soft skin that is sometimes stretchy, short-sightedness, frequent joint cracking, partial and full dislocations, GI tract disorders, and dysautonomia. Also, sufferers will generally be chronically fatigued. Diagnosis of hypermobility type is based on the Baton score and the Brighton scale. To be considered hypermobile, someone must have 4 or more of the points shown. However, even if a positive score is indicated, this does not necessarily mean that the individual has EDS hypermobility type, as some people are naturally flexible. To be diagnosed, a patient must have either 2 major criteria, 1 major criteria and 2 minor criteria, 4 minor criteria, or 2 minor and a diagnosed first-degree relative. There are several conditions associated with EDS hypermobility type, and many sufferers will also have these conditions alongside EDS. A few of these are irritable bowel syndrome, gastroparesis, gastroesophageal reflux disease, dysautonomia, and Chiari malformation. IBS is a long-term condition which can cause symptoms such as cramping, bloating, diarrhea, and constipation. Gastroparesis is a condition in which the stomach literally becomes paralysed. People stop being able to digest food properly, and the stomach stops emptying in the usual way. GERD is where the contents of the stomach are able to travel back up to the esophagus. It is caused by a leaky valve at the top of the stomach. There are 4 types of Chiari, but the most common type is type 1. When someone has Chiari, it means that the lowest part of the back of their brain is slipping down into the spinal canal. Symptoms vary from person to person, but in general, they can be things such as headaches, neck pain, dizziness, and balance issues. EDS hypermobility type is autosomal dominant. This means that in a couple of one person with EDS and one without, the child will have a 50-50 chance of having EDS. However, no specific gene defect has been isolated for hypermobility type yet, but there has been a gene identified for the other 6 types. A combined incidence rate for all the types would be around 1 in 5,000, but hypermobility type may affect 1 in 15,000 to 20,000, and classical may affect 1 in every 20,000 to 40,000. There is no cure for EDS. Treatment is about pain management and strengthening the muscles in order to better support the joints. In some cases, surgical intervention is required to repair the after effects of recurrent subluxation, partial dislocation, and dislocations. If you suspect that you or someone you know could have EDS, a rheumatologist is the best way to get diagnosed. Remember, EDS hypermobility type is in the majority of cases not fatal. However, some of the more severe types such as vascular can be, so it is always best to seek diagnosis if you have a suspicion that you could possibly have EDS. Remember, be aware of the rare.